Welcome to this week's instalment of Wellness Weekly. This week I wanted to discuss an issue which may at first not be seen as something relevant to you. However, the many and numerous benefits associated with breastfeeding is something we all should be aware of, whether we are mothers, fathers, grandparents or just concerned friends. In today's busy and hectic lifestyle, there has been a shift away from breastfeeding towards bottle feeding. Now, this may be for a very good reason. Breastfeeding in many cases, for whatever reason, may not be appropriate for some mothers. If breastfeeding has become an emotional ordeal and you have sought guidance and support, then be comfortable that you have done all you can. In these cases, milk formulas can be of great benefit. However, before you make the decision or your partner makes the decision to stop breastfeeding, please make sure you are doing so for the right reasons. Many of us are aware of the saying, breast is best, and yet often there is little information readily available on the benefits for mother and baby. Australia's National Health and Medical Research Council recommend that you breastfeed exclusively for at least the first 6 months, while the World Health Organization recommends breastfeeding into the second year of life. So let us explore some of the benefits associated with breastfeeding. A mother's milk is pure and natural sustenance for a baby. It constantly changes to meet the demands of a baby. From the amazing health-giving and immune potentiating factors associated with colostrum, to the mature milk which kicks in at about 14 days and will continue to be produced for as long as you breastfeed. In fact, research has shown that a mother's milk will even specifically vary in its nutrient level if a baby is born prematurely. So what are some of the benefits of breastfeeding? Breastfed babies are less likely to suffer from eczema, asthma and allergies. Research demonstrates that infants exclusively breastfed for 16 weeks or more have a 50% lower rate of ear infections. According to an article published in the Journal of Developmental Psychobiology in 2000, breastfeeding significantly increases the short-term attentiveness in 4 to 6 month old infants. According to a study carried out in the Netherlands, breastfeeding may protect infants from cardiovascular disease later in life. It was demonstrated that subjects who were bottle-fed had an increased risk of cardiovascular disease and higher cholesterol levels as compared with those who were breastfed. An article from the Journal of the American Medical Association published in 2001 supports previous evidence which indicates that breastfeeding decreases a newborn's chance of developing gastrointestinal infections and eczema. A paper presented at the Pediatric Academic Society detailed how breastfeeding for 6 months provides a greater reduction in a baby's risk of respiratory infections than breastfeeding for fewer than 6 months. A research study published in 2001 clearly demonstrated that babies who are breastfed for at least 6 months grow to be more intelligent than their peers who are breastfed for less time. According to a paper in the Journal of the National Cancer Institute, published in 1999, infants who are breastfed are less likely to develop leukemia. The results showed that children who breastfed for at least 1 month had a 21% reduced risk of developing the disease. In addition to this, the longer a child breastfed, the longer were the odds of that child developing leukemia. Specifically, children who breastfed for over 6 months showed a 30% reduced risk. There are even financial benefits to breastfeeding. When a child is breastfed for more than 6 months, there is a saving of approximately $1,400 in healthcare costs during the baby's first year of life due to the baby's enhanced level of immunity. Additional savings are realised over subsequent years due to the strength of your baby's immunity and the savings on medicinal costs. This does not even factor in the savings on bottles, formula, etc. Research across the board demonstrates that breastfeeding gives your child the best developmental and emotional start in life.